Hello again and welcome to our Doc Talk. This is North Bay Healthcare's way to reach out to the community. We're talking about COVID-19 and vaccines. And with us today is Chief Medical Officer Seth Kaufman. Take it away, Dr. Kaufman.
Thanks, Robin. Good morning, everybody. We haven't met for some time. I hope you had a nice holiday. Today's a big day. Likely, the FDA's advisory committee, made of academics, experts from across the country, I think it's highly likely that they will advise the FDA to approve approve the EUA, and that the Pfizer vaccine will get distributed. I think that's going to happen today. You never know. It is public, by the way. It's public. People can watch it if they want to. And I assume it'll be an all-day event. So with that, by the way, for my introduction today, I want to spend just a few minutes on our data in terms of the COVID rates, positivity, things like that I always start these conversations with. And then I'm going to talk a little about the vaccine, and we'll go right into your questions. And there are a lot of questions about the vaccine. I think most of our time will be about the vaccine. Although, you can always submit questions about anything, and I'll do my best to answer them. So with that, let's talk about the numbers. They're scary. They're scary. We continue to have very, very high cases of COVID in our county. We know in the state and across the country. We know yesterday 3,055 people died in the U.S. from COVID. That's a record amount. Remember, we were just talking about 2,000 cases just recently. So it's an accelerated, exponential increase. And people talk about the surge on the surge, which is kind of a silly phrase. I think the statisticians out there are saying this is what we expect when things are spreading this quickly, right? When one person can affect many others, you can imagine how that quickly becomes kind of a vertical line going straight up. And that's what we're seeing right now. So there's really no sign of plateauing right now. This was also predictable when you look at the whole timeline from Halloween. So let's review that, and then I'll give you some quick numbers. Right, Halloween, we started seeing a rise in cases. It was mostly younger people. We didn't see a lot of hospitalizations at that time, kind of as expected. There's no doubt we have young adults, middle-aged, all ages in the hospital, but the majority of people that get sick from this are older. So we saw a rise in cases in the community, but not necessarily a rise in cases in the hospital. That's November-ish as post-Halloween. Then, as predicted by our experts, public health leaders, despite all the efforts to try to minimize those multi-generational gatherings around the holiday time, Thanksgiving, things like that, we started seeing a secondary spread, and from young to those at risk, older, and our hospitalizations ran up. And then where I'm going with this, and then as expected now our death rate's going up. And that's what we're seeing in the state, in the county, and right here at North Bay Healthcare. The county reported, this week, many days with over 200 cases in one day. As a comparison, the spike over the summer, which felt very busy, and we were all just, really trying our best to control it. We were talking about 140, 150 cases at the peak. But right now we are, 222 cases in one day on 12/1 in Solano County. On 11/17, 200 cases. So a lot of cases, a lot of cases. Our positivity rate is 12.8% as reported by the county yesterday. It's been up as high as 15% or so, very, very high. Remember the purple threshold for the highest risk level set by the state, we think about north of 7 or 8%. Really, really high rates, really high rates. And across the board, the hospitalization rates in North Bay are high. We have dedicated COVID units in our ICU. We have it in our floors. We are, we have our patients with COVID contained, but the reality is that we have a lot of patients. We have a lot of patients, and as you're seeing from the news, there's no doubt that ICU capacity is difficult, staffing is difficult. I think you know those stories. They're all over the news, and I know everybody here at North Bay is doing their best to help our community and to stay safe. So and that is that's really the numbers I have for you today. With that, let's talk a little about the vaccine. I think today is a really important day, as likely the Pfizer vaccine will be accepted and they'll get the EUA. The vaccine looks very, very promising, and I think appropriately there are many out there that are skeptical. Maybe have concerns that it was approved so quickly, and let's talk about that. Maybe concerns around, like, I just don't want to be first in line to get something new like this. All that is really, expected, and I think it's very normal and rational and understandable. I just want to comment on those things a little bit. So keep in mind, this is a new type of vaccine. Although when you look at the science of how it was developed, the mRNA vaccine, it really, in many ways, on the surface, looks safer than vaccines we've had our whole lives. We get vaccines where it's a weakened virus. It's actually the virus, and it's weaker, so it doesn't make us sick. This is a piece of RNA that goes into our cells and stimulates development of the protein on the surface of the virus, and then that RNA is like gone. It actually has a very short half-life. It really doesn't survive outside very well in your tissue very well. So on the surface, it was expected to be very safe, honestly. And then when you look at the study, 40,000 people is a lot. It's a good study. And the phase 3 studies from these pharmaceutical companies are pretty standard. That's normal. The only thing that's different in this vaccine development process is the timeline. And maybe you're like, yeah, you might be saying, yes, that's the problem, is that have we watched this long enough? Most serious side effects, if not all, are observed in the first 2 months of vaccine development. That's what, in these studies, that's what we've seen in previous vaccine development efforts, and that's why the FDA chose 2 months before they would actually assess it. That's where we're at now. We're at the 2-month mark, and that's why everything's happening this week, with the FDA and ACIP and this advisory committee. So really, these companies are following the rules, are doing robust studies. The timeline, of course, is all about trying to save lives, right? So as every day goes by that we're not vaccinating, people are dying, and that's really the struggle and the expedited nature of this vaccine development. The side effect profile looks very typical of other vaccines. Shingles, our other vaccines have pretty high rates of like soreness in the arm and headaches and fatigue, and so you should know that those don't feel great, but they're sure better than having COVID. My last introductory comment about the vaccine is that often I get questions around kind of risk-benefit, and hey, I'm young and healthy, like my chance of dying from COVID is so low, like why would I do this? And my answer to you is, if you fall into that category, my answer to you is it's really not just about dying or death, which of course is horrible, but there's an epidemic of chronic symptoms from COVID. Even people with mild symptoms. Europe has rehab centers for those with the COVID-19 fog, the headaches, the concentration issues, the fatigue, the breathing problems because your lungs are scarred. So there's so much more to this virus, sadly, than honestly, just people getting sick and feeling better after. And that's one reason. Another reason why is that it really does spread easily. It spreads much more easily than flu, right? It spreads more easily than flu. It causes chronic symptoms much more likely than flu. I mean, people, even if you get the flu, most of the time, unless you die from it or get severely ill, you're going to be fine eventually, whether it takes 6 weeks or not. Flu really lasts a while, but the reality is that you'll be okay. We're seeing much more chronic symptoms with COVID, and the spread is so much higher, the risk of spread. So the reality is I look forward to the day when I can hug my parents, when I can see my community, when we get to a point of vaccination rates and we see the rates fall dramatically with vaccine implementation, where we will have a relaxation of the mask wearing and this distancing. We can't do that yet, right? We're not even going to be close to vaccine rates that allow us to do that, and we have to really see the data. We need some data showing that rates are plummeting, and then I feel confident that we'll start seeing some efforts to normalize our lives, but the first step is getting that vaccine. Okay, so I'm going to stop there, and I'm happy to answer any question. Again, a big day with the vaccine. And with that, Robin, what questions do we have?
Well, just a reminder to those who are watching, this is like any other Facebook post. If you type in the comment, we'll see it and be able to pass that along to Dr. Kaufman. So feel free to ask any questions. Let's just start by talking about what kind of planning is being done for distribution of the vaccine locally. What have you heard and what's happening here?
Yeah, that's a good question, and one I've gotten a lot. So the question is, what's happening in terms of distribution? There's a lot of work within the county, within the state, to get this vaccine distributed as quickly as possible once it's approved. Solano County is getting 3,900 doses as a start from Pfizer. We expect it sometime next week. Those are all estimates at this stage. And of course, you know the challenges. This first vaccine, Moderna, is probably about another week away, and that has different cold requirements, but Pfizer requires this extra cold storage. And so the answer is there's simulation exercises, there's group calls, conference calls, meetings, discussing like step by step how that vaccine is going to get into the hospitals, which are the first who are going to be receiving them, and out to those highest risk healthcare workers and others who need the vaccine right away. So the answer is lots of work behind the scenes, making sure that it's transferred, quickly, and we don't want one vial to spoil, right? So the whole piece of like, how do we keep it cold till we need it and have it in the right place at the right time? Lots of work from our California Department of Public Health to our Solano Public Health to all the hospital partners. It's a daily discussion and a daily effort, because again, we see this as one of the most important efforts in this pandemic.
Okay, we have a question from Myrna, and thank you for submitting a question. She's curious, is the vaccine safe for pregnant women?
Yeah, that's a really good question. Is the vaccine safe for pregnant women? Was not studied. That might be disappointing to you. Was not studied in this phase 3 trial. So I don't know exactly what the FDA is going to say today on that. I think there's a good chance that at this stage, I don't know. There's a chance they'll say that we're not going to, we're going to get more data before we consider it in pregnant women. It was not studied in pregnant women, so they were excluded in this first trial of the vaccine. So in my opinion, it's anyone's guess at this stage, and maybe something's being said right now while we're on. But I don't have an answer for that one. But just know that it was an exclusion criteria for that phase 3 trial of 40,000 people. There was nobody pregnant, at least enrolled in that study.
Okay, how soon after you take the vaccine are you protected? And do you get any protection from the first dose?
Yeah.
Or do you have to have both?
Do you get any protection from the first dose? Do you have to have both? And how protected are you? The data out of Pfizer, and I'm going to stop for a second and say that medical experts, myself and others, we don't make medical decisions based on pharmaceutical company studies only. We wait for independent assessments. And I'm sure you have many times in your life when you thought, I wonder what the agenda is for that company. And I think pharmaceutical companies have done an amazing job. And they would say it too. They would say, test it, study our data, and make sure everything we did was perfect. You can't beat independent assessments. So I'm just putting it out there that what I'm telling you is what I've seen in the FDA assessment and review. And of course, we've been reviewing everything. I'm not, I don't think I would make a decision based on like media reports or Pfizer saying, hey, this is a safe vaccination. You want independent assessments, and so that's what I'm commenting on. The FDA reports that we have reviewed so far, and we'll see what comes out today as we, from this advisory committee. So what we have so far is the FDA kind of review and agreement. There's some nuances, but essentially their comments and review of the Pfizer data is that after the first injection, you are partially protected. 7 days after the first shot, your chance of getting COVID is low. So they saw about an 85% effective rate. Maybe it might have been a point up or below. I forgot it was a little less than that, a little more than that. And then that 95% that's all over the news was 7 days after the second shot. The only thing to know about that is that the numbers are very low for that first shot. Like you can imagine, that means what they're trying to figure out is those who didn't have COVID first, who got it in that window of those 40,000 people, 7 days after the first shot, and then they, until after, 7 days after the second shot. So I'm just saying the numbers are low, period, but there's still a huge difference. Those who got placebo, did not get the vaccine after the first shot, much higher risk versus those who did get the vaccine a shot, even 7 days after the first dose. So partially effective, but you need to get both doses. And those, including us, are really, those who commit to the first are committing to the second. To have really complete, we want that 95% protection.
How will you ensure that the people who get the first dose will get the second one in time?
Yeah.
And will you be first in line?
Okay. Good question. So the question is how are we making sure that the second dose will be available and ready? And the second question is, will I be first in line? So I'm going to answer both separately. So again, we are practicing, we're getting ready, we have a whole setup so that we make sure that from an infrastructure perspective, we're ready to deliver that second dose. Otherwise, we have Pfizer's commitment and our county and others' commitment that the second dose will be sent to us in time. So when you hear about the 3,900 doses, for instance, that are coming to Solano County, the commitment is that there'll be another 3,900 or maybe more. We'll see how it goes. But at a minimum, we'll have that second dose 3 weeks later, ready for administration. That's really coordinating with Pfizer and our county and commitments, and everybody's working on this, so I feel very confident that will happen. Internally, of course, we're very used to at NorthBay Healthcare and our other hospital partners, health system partners, we're very used to doing widespread flu vaccinations, right? Pediatric vaccinations. We do vaccinations all the time. We know it well. So we are very comfortable doing a widespread vaccination campaign. And there are vaccines that require more than one dose. We do it well. We have no problems internally making sure that structure happens. And I don't think it's a wild card in terms of having Pfizer make sure they send that second dose. They're already preparing for that. So I hope that helps a little bit. I'm happy to be first in line, really first in line, first group. I'm very confident in this vaccine and what I've seen today. I'll be more confident when this advisory board today of experts come out and agree with the data sent by the FDA, sent by Pfizer. I'm very supportive of the vaccine. And that's really as objective as I can be. Like, I've seen the data, I've seen the side effects, I've seen the serious side effects that really are side effects, not side effects, serious outcomes of some people in the study that are really things that we see in the general population when you study 40,000 people with anything. People are going to have heart attacks, they're going to have anaphylaxis, and we can talk about that on this call. But the reality is that when I look at the risk and the benefit, I think the benefit far outweighs the risk.
Well, it's interesting you brought that up because we have a question about can you address any allergic reactions in folks?
Yeah.
In Britain in particular, I think they've already started.
So 2 cases in Britain of anaphylaxis. And keep in mind that those 2 medical workers already had high risk for allergies. They carried EpiPens with them. And for those of you who carry EpiPens, you're always looking for anything that possibly could cause a problem. I still need more data from that, right? So I want to see other information around what happened. I do think that we also know that anaphylaxis happens. So a reminder, actually, in the placebo group in the Pfizer study, 1 person had anaphylaxis. So that's placebo. They didn't get anything. So it happens. It happens. And there can be allergic reactions to this vaccine. Again, how often does it happen? Very rare so far. And can it be managed? It can be managed. If you're in that high risk group, you carry an EpiPen, you've had anaphylaxis in the past, it's more of a discussion. It's more of a discussion. Do we wait a little bit? If you're in a high risk group, if you're a healthcare worker and really need that vaccine, I think I don't have a confident answer today, like just do it. I think in the coming days we'll have more data. How many people really total have had it in the UK because they're a little ahead of us? How many people actually had an allergic reaction? Can we be a little more specific on what we think people are reacting to? All that is going to be assessed and put out. But right now, it doesn't change my opinion because the numbers are still really low. I mean, we're already vaccinating thousands and thousands of people in the UK and other places. So I think overall that number is low, and my only comment and reservation is those who do have a severe reaction and they know it and they carry that EpiPen, I think that's a case-by-case basis. Let's talk about it. Where do you work? What do you do? What's your exposure risk, right? Who do you live with? Are you taking care of your family member who has cancer and is 90 years old, right? There's so many other questions. And so I think it's a case-by-case basis if you're somebody who has had anaphylaxis, especially multiple times or with multiple allergies from things.
So if someone was allergic to shrimp or something, should they avoid the vaccine or?
No, there's no connection right now between egg, shrimp. unless something came out in the last hour. There's nothing that's come out showing a connection with those things. I think, again, if you're allergic to shrimp, is anaphylaxis, diagnosed anaphylaxis, not a rash, not I just don't feel well after, like you have anaphylaxis from shrimp, then it's a discussion with primary care. Discussion with me if you want to reach out to me. I'll talk it through with you as we see the data more in the coming days. But if you get itchy from shrimp, don't do it. And it's not because shrimp is connected to this vaccine, but we are looking at people who have who are at risk for anaphylaxis. Period. It is not bad to think about them on a case-by-case basis, but not because there's shrimp in the vaccine.
And the plan is that healthcare workers on the front line will be those getting it first, right?
Yeah, I will tell you, I'm very transparent on these talks. So the question is about priority groups. There are so many different priorities and tiers that it's very easy to get confused about them. Very, very easy. I mean, just Google it, and you will just be like, what is this about? Because there's priority levels from the CDC. There are priority levels and tier levels with the CDPH, and then each county also is setting up priority levels to kind of help with distribution of this first batch of vaccines. So the answer is yes, though. In all those, the one commonality with all these priority and tier levels is that healthcare staff with repeated, extensive exposure. And of course, we use PPE religiously and are watching, we are always keeping staff as safe as possible. We have adequate PPE, but those who are treating and evaluating patients with COVID are the first in line to get the vaccine. As you know from what you saw in the UK, and if you saw the kind of the votes from ACIP and some of the discussions within California, our nursing home staff, our nursing home residents at the highest risk for death and severe illness are also in that top tier, but just below healthcare staff who are in the front lines of the COVID efforts.
All right. Maureen is asking, what does the vaccination rate have to be so we can eliminate masks?
Okay, the question from Maureen, very good question, is what does the vaccination rate need to be to eliminate masks? I don't have a definite answer for that, but I'll tell you what I think based on what I've read and see. So herd immunity levels is probably going to require about 70%. But I'm talking about that a little early because you're not going to like this, but it's not 100% that the vaccine eliminates transmission. It just won't make you sick, which is great because you don't want COVID fog, you don't want headaches for months on end, you don't want to have concentration problems and not be able to work and all those things. You don't want to die from it. But we'll know very quickly whether it also really eliminates transmission. If that's true, then vaccination rates in the 70% range, like 70% of your community, however we define that, will likely reach a level of herd immunity where these other transmission precautions, distancing, hand hygiene, mask wearing, will not be as important. That's a good reminder, and it's tough for me. I think many people probably watching this would be also first in line with me if they knew that the week after the first dose or the week after the second dose, when their body has all the antibodies, that they could just rip their masks off and hug their parents, right? And the answer is that we can't do that yet. We can't do that yet. We have to continue with these other efforts. By the way, if you do that, if you're like, well, I'm going to get the vaccine, but I'm just done with the rest of it, cases won't fall. They'll just continue to go up for a while because it's going to take time. It's still partial immunity. 95% is excellent, but it's not 100%. And we're talking about very big numbers, right? Millions and millions and millions and millions of people. So if we could just all hold off, keep those, if we do the vaccine, plus and overlap that with all these other transmission precautions, and we're as good as we are now. We are as good as we are then after the vaccine as we are now. The cases will start plummeting, and then we'll see our health officers and our state and our country starting to loosen criteria, including mask wearing. If we don't do that, cases keep going up. People are going to be scratching their heads if the vaccine's working. When there's a party and no one's wearing masks and now maybe less people get it, but there's still going to be a lot of people getting it. There's going to be news media all over the place about mask wearing. We're going to have to we're going to go into lockdown again. I don't want that. I want this to be it. So keep wearing your mask, get the vaccine, and I'll betcha as case rates drop, we're going to start loosening those criteria.
Missy is asking, do you have enough staff to do all this vaccination work?
Do we have enough staff to do all this vaccination work? Yes, because it's the most important thing we can do short of managing all the patients who are sick with COVID. The answer is that we're NorthBay Healthcare, we can do it. So yes, we can and we will. It's not just us also. Our public health colleagues, we have nurses that are vaccinating. There's our EMS colleagues, paramedics, wonderful people. We have, we're really lucky here in Solano County. We have a lot of, just like NorthBay Healthcare, we have a lot of independent businesses that are just all about Solano County. And of course, our multi-county businesses, medical businesses out there, our Kaiser and Sutter and others are also, of course, very committed to NorthBay, very committed to our county. Everybody are using their staff, and I know our EMS staff are helping with vaccinations and helping us manage COVID. So yes, we have enough staff, and we have a lot of partners to help us.
Diane asks, do people who've had COVID not need the vaccine? Are they already protected?
The question is, and it's a good question, if you have a confirmed COVID, if you have a confirmed test that you had COVID, do you need to get vaccination? And the answer is yes. I'm going to ask myself a question, but Dr. Kaufman, what if I even go get antibody testing and it shows I have antibodies? Do I need to get the vaccination? My strong recommendation is that you get the vaccination. And this is from a number of things. There's actually studies out there showing whether people who got the vaccination, got COVID, can get re-exposed, and we do see cases where people get COVID again. And we also see that there's still transmission risk. And the reason for that is that there's still, artificial boosting of your immune system from vaccinations is different than natural immunity that you get from the virus. So the answer is those who've had COVID are absolutely probably immune to some degree. We don't completely know. But if you want to be safe, get the vaccine. It's not going to hurt you to have more antibodies to it. The reality is that we know that prolonged immunity is probably, you have a better chance of prolonged long-term immunity if you get these 2 shots versus the natural immunity. And by the way, let's hope it doesn't happen, but if in a year or 2 COVID comes back, let's say we kind of wipe it out, we think we wipe it out with the vaccine, but a whole group of people who got COVID said, I'm going to skip the vaccine, and what if your immunity drops? Because we don't know, and we have seen some studies showing that immunity drops over time with the natural. Naturally you might get it again in a year or 2, and there's going to be all these vaccinated people who are doing okay. So that's all. I mean, I can think of a lot of different scenarios, and it all points towards all of us getting vaccinated, whether you have had COVID or not had COVID.
That kind of leads to this question, which is how long will the vaccine last? Will it need to be administered yearly, like the flu vaccine, or every few months, or whatever?
The question is how long is this immunity going to last from the vaccine? No one knows. No one knows. So we don't know how long it's going to last. If it turns out that it requires annual shot, so be it. We'll cross that bridge when we get there. The one positive thing, there's so few positives out of this pandemic, is that technology has really improved in terms of vaccinations. I think there's a lot learned, or even about the flu vaccine, and I won't be surprised in the coming years that there's combination vaccines, or vaccines, maybe there'll be a flu vaccine that doesn't require an annual shot, and I've seen universal vaccines that have a bunch of different things in it, and they're only going to get safer and safer and easier, because that's how a free market system works. So, so the answer is I don't know, but I am impressed by the technology, and I'm optimistic that whatever happens with the immunity levels, that we'll be able to manage it.
What about children? Should they get the vaccine?
Yeah, children were not very. The answer is I don't know. It's just, honestly, it's very similar to the question at the beginning about pregnancy, and that's more. I want to wait to see what the advisory group says today. As we know, by the way, we want our children vaccinated, but they actually, especially the younger children, spread it less, don't get as ill on average, but not a very well-studied group. Just the N was low in this phase 3 trial with Pfizer. So, but there's a lot of other studies out there. I think there's going to be a lot coming out. So on that one, it's also a wait and see for our pediatric groups, just like for our pregnancy groups.
Now there's a second vaccine, Moderna, that's going to follow up on this one. Is it also a 2-shot regimen? And what about the storage of these 2 vaccines, the refrigeration?
Someone's asking about Moderna, which is going to be considered by the FDA in about a week. Essentially, everything is a week behind Pfizer. Solano County is expected to get about, if it's approved, Solano County is expected to get about 4,000 doses in that first batch that is sent out. In some ways, Moderna is an easier implementation. It is 2 injections, a month apart or so, something like that, and but it doesn't require the cold storage. It doesn't require the cold storage. You should know, NorthBay, we have the cold freezer, so honestly, cold storage is not a concern of ours. By the way, if Moderna, it's not going to happen. But if Moderna sent a week, oh oops, we want the cold storage, we have it and we're ready. So that's actually not even an issue. It's a non-issue for us, and so we are ready and have no concerns about spoilage or ineffective vaccines because of temperature. But yes, the Moderna one require standard freezer and refrigeration, does not require the extra cold storage of Pfizer.
Okay, as I'm sure you know, there are a lot of people out there who are opposed to any kind of vaccination. How difficult is the anti-vax movement going to be in making education efforts?
There's a question about how difficult will getting education out be? How difficult will it be for us to disseminate education with some of the anti-vax efforts? I think the key is just to put up that education. I trust our community, and we have a lot of very smart people, and I think really our efforts here at NorthBay is to send out as much information as we can and let people digest and assess for themselves. That's really how things should be, and so I'm not too concerned about it, I guess, is what I'm saying. I both respect some of the perspectives around. I respect everybody's perspective, and I think we just have to come together and make decisions together. In my conversations, I think, especially as for those who've really seen the damage of COVID, our nurses, our physicians, our EVS staff, so that's our cleaning staff, everybody who has really seen firsthand, I think, understand the devastation that COVID can cause, and understand how important this vaccine is.
And just, we're about out of time, but can you review guidelines for social distancing again, like in wearing a mask? How far do you have to be apart and so forth?
The question is somebody's asking, maybe in the context of this vaccine now, like, are we changing anything in terms of our precautions? And we're not. One of my kind of mantras is to remind people that, hey, if you're concerned about this vaccine and the side effects or things like that, a reminder that we have wonderful and simple prevention measures right here at our disposal right now. And it doesn't require a shot, doesn't require a super crazy cold freezer. Mask wearing is very, very protective. Distancing is even more protective. Of course, hand hygiene is important, and we do it religiously here at NorthBay. And so 6 feet is still the rule. A reminder that eating together, especially indoors, is a recipe for getting COVID, and that there's likely some aerosolization during that, so the farther away you can be, the better when it comes to eating, talking loudly, singing, right? All those things are definitely causing more of a spread. So I don't, in my own family, in my own life, I don't like count 6 feet. I just be as far as I can, and everything is outside. I mean, we're shelter in place right now, but when we are allowed to, everything is outside and as distant as possible. So I hope that helps.
Okay. Well, we're out of time, but we do want to let you all know that the talk is going to take a bit of a hiatus because of the holidays and the New Year. So the next talk is scheduled for 10 a.m. on Thursday, January 7. We'll be back here and talk more about the vaccines and COVID and what you need to know.
I'll see everybody on January 7th at 10 a.m. Thanks for joining.
Thank you, Doctor.